Well, it's time now for our Tuesday Health Report, and joining us now is Africa 54 Health correspondent Linord Moudou with a new look at global cancer numbers. Linord.
Hello, Vincent. The World Health Organization says about 8 million people die of cancer every year. It is one of the leading causes of death in the world, particularly in developing countries. 60% of new annual cases occur in Africa, Asia, Central and South America. Cancer affects everyone, the young and old, the rich and poor, men, women, and children. There are more than 100 types of cancers. Some of the most common cancers in Africa are prostate cancers in men and breast and cervical cancer in women. The WHO says 30% of cancer can be prevented, and one way to do so is by raising awareness with a day such as World Cancer Day on February 4th. And joining us live via Skype from Geneva, Switzerland for more on the subject is Cary Adams, Chief Executive Officer, Union for International Cancer Control, UICC. Mr. Adams, welcome to the program.
Thank you very much for inviting me onto the program.
Let me ask you this question first. 30% of cancers can be prevented. At least that's the statistic from WHO. How do we do that? How do we prevent cancer? Is this a bold idea?
Well, no, not really. I mean, the science of cancer over many years has identified the core risk factors, tobacco, lack of physical activity, diet, things like that, which are causes of many of the cancers. And these have been embedded in instructions and guidelines from the World Health Organization to countries around the world for them to actually take a lead on those. And particularly in Africa, where tobacco is probably not the major issue compared to other countries, but things like vaccinations for things like HPV vaccinations, which allow over a period of time us to avoid more cervical cancers than we currently see.
But if there are ways to prevent it, of course, people are aware, but where is the problem? Why is there such an increase in the number of new cases? Is it because of the message that is not well catered, or that doesn't fit within the population, perhaps?
Well, I think it's a complicated issue. Certainly, there's a question of getting messaging across, and that's why we have, for example, World Cancer Day every year to reach out to the general public through organizations like yourself to talk about the facts of cancer and what we can do to prevent it, detect it, treat it, and care for people with cancer. So there's that aspect of it. But also, you've got to remember there's large changes in the world, a growing population, an aging population across many developing countries. We're now getting on top of the issue of communicable diseases, and as people are passing through that stage and living longer, then of course the chronic diseases kick in. Now, I will say there's also the issue that many of these chronic diseases like diabetes, heart disease and cancer are born out of Western lifestyles. And as developing countries adopt urbanization and the food habits of the Western world, then you are going to see an increase in the number of cancers. And that does not mean there has to be an increase in the number of deaths. I mean, that's absolutely clear, because we can treat many cancers now successfully as long as we catch them early.
You mentioned the HPV, the vaccine against HPV. If you could pinpoint other concrete steps, maybe one or two, especially with regards to the issue in the developing world, what would you say in terms of prevention?
Well, I would do a combination of things. I think clearly we can do things on HPV and reduce the number of cervical cancer cases in the future. That's absolutely one. Second thing, we can do more screening. And this is obviously dependent on having the necessary infrastructure in primary health care to allow women and men to be screened for prostate cancer, cervical cancer, breast cancer, and colorectal cancer. But more importantly, I think something that we can all do is to encourage people to be conscious about their bodies and to get to a doctor earlier than they currently do. In some parts of the world, including Africa, you tend to see most cancers presented to a doctor when they're at a stage 3 or stage 4 level. And at that stage, the cancer has moved from its site of origin to other parts of the body and become incredibly difficult to actually treat. So the earlier that we can get people around the world to present to the health sector and say, look, we really do have a problem here and we can resolve it early at stage 1 or 2, then we're going to see the mortality levels come down significantly.
In terms of treatment, as you mentioned, very quickly, what do you think, new research, what should be focused on?
Well, I think there's a lot that we know already about, just There's a lot that we know already about cancer, which we can share around the world. We don't have to have new treatment. We don't have to have new drugs. We've got enough that we can deal with the majority of cancers that exist at the moment. So let me give you an example. Childhood cancer in developed countries is a reasonably easy cancer to identify and a reasonably easy cancer to deal with. So treatment success rates for childhood cancer in developed countries are around 80%. The issue is completely reversed in developing countries where it's no more than 20.
Okay, Mr. Adams, thank you so much for joining us from Geneva today.
Thank you very much indeed.
And that was Cary Adams. He is the CEO for Union for International Cancer Control.